Careful. Hold it.
Well, the dog was playing and she swallowed a rubber ball. Super ball. We have already done it in our city. We live in Domodedovo. We have done ultrasound there. Well, there is a suspicion that, well, the ball is in the stomach.
My patient today is a dog called Thea, whose owners assume that she ate a toy, a ball, a foreign object that lays in the gastrointestinal tract for a long time can cause perforation or blockage. That is, there can be some serious consequences. To exclude a foreign object, we have made an ultrasound. I have been doing visual diagnostics for about 5 years. Unfortunately, it was not possible to confirm the foreign object in the ultrasound. We couldn't see anything because there was a lot of gas there. I cannot rule out that Thea hasn't eaten anything. The owners worry about her more than they should.
We saw these types of red weeping sores raised above the skin.
Ornithosis is a bird's chlamydia, which can be, in fact, transmitted to a person.
Oh, my sweetie pie.
Oh, what's wrong? Does it hurt?
Hold on.
So, let's listen to you. You do not scream. Good bird. Well done. Let me listen to you. Come on. Hey, come on. Don't bite me. Don't worry. Come on. I've just praised you. That's my boy. Come on. Okay, okay. You're a hooligan. A hooligan. The owner has bought himself a bird which he wanted for a long time. In the aviary, yes. Well, the aviary means overcrowded keeping of birds. So, yeah, I see. You do not want to obey. He has inflammatory processes in the upper respiratory tract for now. That is snot in the popular parlance. These can be the symptoms of some very dangerous diseases that are often transmitted to birds kept in aviaries. This is ornithosis. They can have 5 or more parrots in a large aviary. Accordingly, if some animal in this aviary is sick with something, well, an infectious disease, a parasitic disease, and so on, then his neighbors are 100% sick too. Not only this disease is dangerous for birds, but it is dangerous for humans, and people of almost all age groups can get sick. Ornithosis is a bird's chlamydia, which can be, in fact, transmitted to a person. Ornithosis is transmitted to humans through airborne droplets. His nostrils are blocked. You will need to drip drops and go on a course of antibiotics. Then, do not be afraid. My patient today is a dog called Thea, whose owners are assured that she ate a toy. We will continue diagnosing because we need to be sure that there are no foreign objects in the dog. Because if a foreign object is there, it will be much worse. Usually rubber, for example, some lids of all kinds of vials that animals swallow periodically, can be easily seen on X-ray. And we also took a picture. And I haven't found any dense inclusions, neither in the stomach nor in the intestine. You can see that denser particles, like, for example, this little thing here, are painted white. Usually all rubber items, lids of bottles, which they grab, they are darker. That is, well, on the X-ray, they are respectively bright. I think that the owners could be very scared and could take, say, their fantasies for reality. Such things happen from time to time. That is, I can't confirm or deny the presence of a rubber ball in the stomach. Hush, 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 hush. At least it's not in the intestines. If it was in the intestines, there would be gases. Have you taken the second picture? No?
Let's see. Ah, you've marked.
From this side. Yeah, I see.
That's all. That's all.
Now let's do it fast.
That's all. We're ready.
Okay, do I push?
Yes.
You cannot see the ball on this X-ray.
But what did they see in Domodedovo? What did they see in Domodedovo?
They just saw a shadow.
And we have seen the shadow or not?
We see shadows everywhere. We've had Thea's gastrointestinal tract X-rayed, and unfortunately, there were no clear signs of obstruction. But this may be due to the physical structure of the ball. That is, if it was very dense, from dense rubber, then it would be clearly visible. But apparently, the composition of the foreign object can correspond to the soft tissue of the body. Then it is very difficult to differentiate. The most important thing is that the intestinal pattern is even.
So it's not in the intestine.
Yes, it means that it's not in the intestine.
So we should do EGD. The ball itself is not visible. We see changes in the stomach, in the intestines, which only indicate obstruction. So you should wait for about an hour then. In the hall there, sit down in the corridor, well, where you were waiting.
All that remains for us to do now is EGD, the most reliable diagnostic.
Put it on the table, right here.
Pusia.
Let me touch you a little, my sweetie. Uh-huh. Uh-huh. The cat Pusia came to us today. She's a sphinx with lesions on the back and on the right pelvic limb, with weeping lesions.
We've been receiving treatment for a long time, for a year and a half in this clinic only.
So how long ago have you stopped eating Medipred?
Well, I think something about a week and a half ago.
Yeah, and I immediately noticed that it got worse.
It started again. Well, in fact, at first it was not so scary. I thought this was a small problem, but then when the treatment protracted for many years, then of course I became scared for her.
Currently, this animal is diagnosed with atopic dermatitis. This is a really crazy itch. And if we think back to Pusia sitting in line and waiting for the appointment, she was licking herself nonstop. Now you can start giving her any food you like. And you'll have to take pills. Hush, hush, sweetie. That's all. Don't be afraid. Honestly, I don't really like the diagnosis of atopic dermatitis because it's controlled mainly by drugs that are far from useful in the body. But there's no other option at the moment in veterinary medicine. And in the course of the diagnosis today, we've also found eosinophilic granuloma. And there still are the eosinophils. That is, the diagnosis of eosinophilic granuloma hasn't disappeared anywhere. She still got it. Eosinophilic granuloma is a lesion that occurs against the background of an allergy. That is, it can't happen by itself. This lesion looks just like the one we saw. These red weeping plaques raised above the skin. But you need to understand that you'll give her these pills not for a short period of time, but for the rest of her life. Otherwise, if we cancel them, everything will come back
Well, compared to other diagnoses, it's much better. It's easier to keep her on pills her entire life than to hear that she can die at any moment. So this news even cheered us up.
Things will turn around for the better very quickly. Drugs still do their job, and the itch will go away, and she'll get better soon.
This is called bird hirsuteness.
Oh, my sweetie pie. Hold on.
We'll take it out. Calm down. We will make it. I would like to have done this endoscopically. We live in the 21st century. We have all the necessary equipment. We have experience. But sometimes it cannot be done.
And there is another problem here. You came in with a respiratory disease. He has another problem, a pathological molting. That's what we have, you see? This is called bird hirsuteness. You see that, well, some feathers look like hair. That is, they look like hair, not like feathers. New feathers come out in such a cover, and inside this cover, the feather is developing. And this parrot just doesn't have trace elements needed to create a proper feather. That is, trace elements that should have been used to build this feather simply don't exist in the body. He's not supposed to molt for a month, especially in the summer. This is some kind of pathology. Large birds may have a pathological molting because of boredom, the so-called French molt, which is incurable. That is, they tear off feathers out of boredom, and their bodies just fail to keep giving pace to new ones. Here we need to find out what his problem is. And for this, we will need first to intensively eat some calcium. All domestic birds, that is, the ones kept in here, have this or that problem. Because people do not feed birds with stones, and they should. But in your case, with such plumage loss, you will have to get some shots. Now I'll fill the syringe. We should fix him. You will hold him for me. It's not very difficult. Birds get their shots with a very thin needle, which cannot, in principle, traumatize the bird. Apart from the fact that we have diagnosed infectious diseases, we anyway have some inflammation of the respiratory system. And we are already preventing it, just removing the nasal mucosal edema and so on. One drug is an antibiotic. You will need to do injections for a week. The other one is calcium, calcium berglaconus, which will enrich his blood with calcium, respectively. And with the mineral feeder provided, the bird should quickly recover. Unfortunately, basically, if after a course of microelements and eating a normal amount of, let's say, stones, the feathers remain the same, then this disease can be incurable.
Is this a lethal disease?
No, it's not. Well, roughly speaking, the bird should molt twice a year within a certain time limit, and your bird will molt all the time. He will be losing feathers the whole year. So now it will be a little unpleasant for him because we need to fix him. Hey, easy, 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 easy. Easy, my good parrot. Come on, let's get him down. Quiet, quiet. Oh, you're a good boy. Here, the problem is that, in my opinion, such birds should live in the wild. They shouldn't be kept in a cage. And I treat animals rather than do something to please their owners. Well, come on, come on. And accordingly, you should hold the body. That's it. And so we take... They have a keel, birds. That is the bone that closes his, well, abdomen. And so we can safely make shots here, because it's impossible to hurt anything. He may bleed, but that's okay. That's understandable. Capillaries are everywhere. Well, how shall I say? The body of a bird, Oh, he's bleeding a little. Well, come on. Excuse us. So, accordingly, that's not very dangerous. You see? Will you be able to do it yourself, huh? You should do them for a week.
Okay, thank you very much.
Goodbye. Get better. If the bird gets an adequate mineral feeder in its diet, then the plumage will get back to normal in a month, maximum 2.
Well, let's see your leg.
Should I lay her down?
No, just turn her sideways towards me. Well, let's handle the leg. Well, what a good girl. Yes. Well, the owners came to the clinic because their domestic fox, here they had bought it, it was bitten by their own home raccoon. Oh, my sweetie pie.
Oh, what's wrong? Does it hurt?
Hold on. Well, be patient, sugar. She feels fine now. We still had to amputate the paw, amputate the tail. Now, she's not in any pain. We just treat her stitches. What a good fox. The fox had an open leg fracture and a tail fracture and severe bite wounds. The fox needed a surgery. We recommended to amputate the tail. Well, and the owner said that they didn't want to do this. They wanted a healthy fox to themselves and for the children, and then decided to go for the surgery. The fox had an operation on its leg, and drains were put. And in a day, everything did not look very good. And so the issue of the amputation of Fox's leg and tail arose after all, because there was nothing to save. Well, the owners decided they did not need such an animal. Well, their children don't. And if you get yourself an animal, you're directly responsible for it. And it's wrong to put an animal down only because you don't want an animal without a paw. We do not throw people out on the street when they lose the use of their legs. It's not right. And so we refused to put the fox down. Hey, look here. Well, Foxy, what are you afraid of, huh? We felt sorry for this 2-month-old fox, so we adopted her and continued the treatment. And now she's already more or less getting used to us, to those who she sees every day. She's not that afraid, and even tries to get closer somehow.
And what's the name of your sugar?
Everything has practically healed up already. I think that in some 5 days or so, we'll take out the stitches, and we already have a person, this is our senior administrator, they are already building her house in the countryside, and they will take her home.
She is so fearless.
I decided to take it home. She will live in the open-air cage in the countryside. And we will love her. How can one pass by her? Who would pass by the Foxy without a paw, after her owners just abandoned her? Therefore, she can't live in the wild. So we're taking her home. This baby is going to live with us, that's it.
They're funny and unusual and raised somehow differently. They are, I don't know, a little bit like people, probably.
We have exhausted all possible methods of diagnosis without the sedation. The owners are 100% sure that the dog has eaten the ball. Therefore, we should be 100% sure whether the ball is in there. That means we should make an EGD. So we will put the dog under anesthesia. Well, insert a tube into the esophagus, and the surgeon will see. He will be able to see the whole stomach from the inside with his own eyes. This is the most effective diagnosis.
We're going to make EGD now to find out whether this ball is there, because so far, we know it only from the owner's words. The X-ray did not confirm this information. Therefore, we do endoscopy. If we detect the ball, Then we will try an endoscopic extraction. If there is really a ball in the stomach, it'll be hard to get it.
Naturally, we decided to do an endoscopic examination and to extract the ball endoscopically as well.
1, 2, oh!
In fact, it took us more than an hour and a half to perform this endoscopic operation. Well, it's such a special nozzle for extraction or for biopsy. Kind of forceps, because it's round and slippery. I can't see well.
What?
I can hardly see anything there. Give me a napkin, please. Open it. Uh-huh. No, open it. Hold it. This is it. I have a feeling that it is the ball. At least it looks like it. Have a look.
Now I cannot see anything.
Yeah, here. It's okay now.
Yes, green slime.
Slime, yeah. We saw a foreign body in the stomach. Now we are trying to get it with these forceps. Just a little bit. Come on, open it. Move endoscope a little forward.
The endoscope.
Yeah. Stop.
Take the basket.
Don't move it. No, it'll be even more uncomfortable.
It's like this.
Well, but the endoscope shows different picture. We haven't even grabbed it yet, so we'll take it out. Calm down. We will make it. Where's a rubber band from here, Sveta? Now, almost. These games could take a while. This is another tool for extracting a foreign body from the stomach or esophagus. Perhaps it will help us to take the ball out, so we don't have to make a surgery. Take it. We could not grab the ball. We tried different nozzles. The ones with sharp teeth, bigger, smaller ones, with a basket. We tried to grab it in every possible way. The ball is very tight, hard, slimy, and rather small. And it prevented us from extracting it endoscopically. What a pity. The fact is, given that the ball is round and very slippery, nothing could grab it. Both forceps and basket failed to pick it because it just slipped away. Therefore, we'll have to do a mini laparotomy. Make a small access to the abdominal cavity and extract it. After 1.5 hours of endoscopy, we decided to do a laparotomy. That is surgery. We talked with the owners, they agreed. Well, because there were no other options, the ball couldn't come out itself. If it gets into the intestine, it will cause obstruction, and an emergency operation will be necessary. While the dog was under anesthesia, we performed a surgery. Within 15 minutes, this ball was removed from the stomach. It's a pity. It is clear that the dog is now well. She is fine. She's healthy. I would like to have done this endoscopically. We live in the 21st century. We have all the necessary equipment. We have experience. But sometimes it cannot be done. Sometimes the objects are sharp, for example, a razor blade and so on. And we do not try to extract them endoscopically. In this case, with a ball, we've tried. Unfortunately for us, and of course for the owners, we failed. But now the dog feels well. Tomorrow, she will go home.